It all began 25 years ago in a cornfield in rural Mississauga. November 2010 marks the 25th anniversary of the Credit Valley Hospital. We started with a kickoff event held in our beautiful main lobby, and CV Glee got the party started.
Lean on me when you're not strong, and I'll be your friend. I'll help you carry on, for it won't be long till I'm gonna need somebody to lean on.
Welcome, everybody. Welcome to our 25th anniversary celebration. For those of us who've been part of this community for 25 years or more, we have witnessed firsthand the evolution of Mississauga. I've lived in Mississauga since 1978, and I can recall the day that I saw the sign on the corner proclaiming that this was the site of a new hospital that was going to be built here. As a nurse and a young mother, I was thrilled with the prospect of working at my local hospital. I had established my roots here in Mississauga, raising my family, and I was excited about the idea of living and working within this community with like-minded individuals who are driven to improve health care for this community. Those early days before the hospital opened on November 5th, 1985, were filled with anticipation, passion, and dedication. We all came from different backgrounds and we had different experiences, and for sure we had different perspectives on the way things should be. But we all decided that we were going to develop the Credit Valley way of doing things and set a new standard, and we were committed to creating this new standard for our community. I am proud of my 25-year history at Credit Valley. In fact, there's 113 employees still employed at Credit Valley that have been here since the beginning.
For 25 years now, Credit Valley has been a cornerstone to this great city. It has been embraced by a community of supporters even before the hospital opened its doors. Before the first baby was born and the first patient was cared for, hundreds of dedicated supporters worked alongside our staff, our physicians, and our administrators for our hospital to make Credit Valley a reality.
Well, you know, as I look back, it's really 29 years, because it's 29 years ago that we started to plan for this hospital. And yes, it was just a handful of people that met in a kitchen in a house in Mississauga, right? And started the planning, and why? What an undertaking, you know, when you think back on it. So it just shows that with a group of committed people determined to build the facilities that a city needs, that we got going. And here we are today, celebrating 25 years. 25 years of looking after the people of Mississauga. So folks, let's go on, encouraged, enthused about the past. Pride in our past and great faith in the future of this great hospital. Have a great day.
Thank you, everyone at the Credit Valley Hospital, for the special care you gave me and my family. I was referred to Credit Valley this past April when I received the joyous news that I was carrying twins. Although I had never been a patient at Credit Valley, I knew I had an incredible reputation, and I immediately felt I was in good hands. I have to thank my labor and delivery nurse, Karen, who was awesome. I truly believe that she had a lot to do with my labor and delivery going so smoothly. There was another incredible nurse with me, Alona, and she was diligent and dedicated to my recovery. It has been a wonderful 6 weeks with Sebastian and Julian, and I am very grateful to everything Credit Valley did for my family. Last but not least, I would also like to thank Dr. Matt Giesler. He truly is our hero.
Clearly, our founders had a vision, and were able to put a compelling story together, paint a compelling picture with very rich colors. Building a hospital back then was not an easy task. Getting those kinds of approvals, and I think about our sister hospital, Brampton, who just built their hospital a few years ago. That was a 30-year journey. So when you think about what was accomplished by those founders at kitchen tables, at dances, I'm sure at bake sales and everything in between, It's an enormous accomplishment to think that we're standing here 25 years later with our success just at its beginning in many ways. Some of you have heard me quote before the African proverb which says, "If you wish to go fast, go alone. But if you wish to go far, go together." So, together we will build, create, and lead better healthcare in Mississauga, in Ontario, and in Canada. I want to congratulate all of us on this accomplishment. I want to sincerely thank many of those who are here today who were there 29 and 25 years ago, and to say to you on behalf of those who are still here working each and every day, on behalf of our community, we take up this responsibility extremely seriously. We are passionate about it, and we are enthusiastic about the future. Thank you.
Happy birthday, Credit Valley. Happy birthday! Happy birthday, Credit Valley.
It's a wonderful day for Credit Valley on this 25th anniversary and celebration. We're delighted to be here today. I didn't deliver, but my daughter was delivered here 20 years ago, so I'm very proud of what we've done here and the future we have ahead of us.
It's wonderful to be here. 25 years to celebrate. It's a great hospital, and it was certainly my pleasure to be associated with it over most of that time.
Credit Valley Hospital, it's 25 years down, a lot more to go, and a lot more progress in a community that very desperately needs the things that people do so well here.
Boy, that's really something.
Isn't that beautiful?
This one's great.
It started with a cornfield and a vision. Back in 1980, an old barn came down in the northwest corner of Mississauga. In its place, our founders built a future. The Credit Valley Hospital became one of Ontario's finest healthcare facilities, providing a future of healing and hope for our growing community. Building that future took teamwork. Volunteer citizens, service clubs, schools, and businesses helped build Credit Valley from the beginning. Our founders broke ground. With hard work and clear vision, step by step, they worked together, creating not only a physical building, but an approach to healthcare built to last. The landscape has changed, but the vision remains, a vision of healing and hope.